So what should the management of this look like? The first thing is flagging to the clinician. There is a record that has some safeguarding information that needs to be considered as we continue to work with this person, either being an adult or a 16 plus, so still a child. It's making sure that if you have any coding that needs to be done, that it is within the record so the patient can be flagged. It's also about understanding who else is in this network, in this family network, who lives in the same house. Do the victim and the perpetrator are both registered at the surgery? Do they have any children? And often the record systems that you'll use will enable you to link the records together. So when someone at the practice is seeing one member of the family, they are aware of who else is in the family, because the risk to a mum, for example, the domestic abuse risk to a mum, will mean a risk to her children. The same way, there's a domestic abuse risk to a dad, will mean a risk of safeguarding for her children, and those need to be considered. Therefore, the links that we can make within the records are so important to make sure that we safeguard them effectively. It's also important to consider, where are they registered at? They might be at one of the local refuges. Therefore, the need to be confidential and not divulge this address is of uttermost importance. So it's really important that you know who is in your local area. Do you have any refuges in there, and are you likely to be seeing victims of domestic abuse? They are displaced to be protected, and if you are, what extra care do you have to have in the relation for these records and these patients?